This week saw the start of Covid-19 J&J vaccine rollout of the vaccine. So far, South Africa has administered more than 6,500 people. Joining us now is Free State Health MEC Montseng Tsiu, who received her injection on Wednesday. MEC, a very good evening to you and thank you so much for joining us. Tell us about the process. Did you feel any pain? Were you scared? We understand that the needle is terribly long.
No, it isn't. It isn't terribly long. It's a normal needle, and I didn't really feel any pain. And ever since I got my jab, I'm still feeling good. I'm happy.
Okay, and what is the mood in the Free State? Obviously, vaccination starting, the rollout commencing.
I think the mood is that is exciting. I see the long queues of the health workers that come to get their vaccination. The only problem that we experienced when we started on Wednesday was the issue of the fact that some of the workers had not as yet received their vouchers because they had just registered. But that issue has been solved. We don't have any problem anymore, and we are able to then give our workers vaccinations.
Now, vaccination is obviously not mandatory. Have you had many that are not keen to get vaccinated?
No, many are keen to get. There are those that are not keen indeed, but ever since they saw the leadership getting the vaccine, they are now all of them saying, when is my turn? When is my turn? And many of them have now registered so that they can get their vaccines. Even those that could not register have asked to be helped so that they can get registered and then get their vaccine.
Let me see, let's talk about the numbers. How many frontline workers do you have? How many are expected to get vaccinated? And obviously, many of those, I presume, would be in the public service.
Yeah, those that are now here in Bloemfontein at this point in time, because we only started in the two big hospitals in Bloemfontein. So far, we have been able to give the vaccines to we started in universities only, which is the only the hospital. Pironomi only started yesterday. Okay, I wanted to go to my numbers here. We have vaccinated 557 so far since Wednesday, the two hospitals. Pironomi has been able to vaccinate 137 and universities 420. But we are left with 7,100 that we still have to register. In 2 weeks' time, we would be done with these workers.
Now, how many doses have you received or are you expecting to receive?
We received 7,600 doses.
So that will take care of. So that will take care of the first phase.
Yeah, we would be able to take care of the first phase. The only thing, because those that have not many have already received their vouchers, because you have to register first and then get a voucher before you can be given a vaccine. Yeah.
So just again, can you recap for us the total number of people that you're expecting to vaccinate, and then what the role?
We are still to vaccinate right now. It's 7,100, but this does not include other districts. This is just for Mangaung district. I've not included the other district. I didn't get their numbers. I only got these numbers for Mangaung because for this phase that we are in now, we are targeting Mangaung, all the institutions in Mangaung, private and public. That is Universitas Hospital, Pilonomi, National Psychiatric Complex, together with our private facilities here in Mangaung.
Now tell us a little bit about the rollout. How long do you expect for this process to take? And when are the next doses of vaccine expected in the Free State?
We are expecting to get the next doses I think in 2 weeks' time. But because 2 weeks will be done, we hopefully with Mangaung, and we are hoping that before we could go to other districts, we would have already received the next batch of vaccines for the other districts. So we are hoping with the healthcare workers, we are hoping that by the end of March we have been able to vaccinate all the health workers.
Misinformation has obviously been a key aspect to the vaccination process. Now, what are the measures that you are taking to inform and educate the people in the Free State around vaccination, its safety, obviously, and necessity, and what it will do to prevent the spread of COVID-19?
Our community healthcare workers have been educated around the issue of the vaccine. They are helping us as they move around in our communities to educate our communities. We also, as the leadership, are taking it upon ourselves to go to the media. We go to the community radio stations, and we also have also spoken to our governance structures, that would be the hospital boards and our clinic committees, to help us, because they are the link between the department and the communities, to talk to the people and give them the real thing and dispel the myths about the vaccines.
Now, MEC, we understand that these vaccines will be done in 2 doses. What is the waiting time between, obviously, you've received your first dose and the time you receive the second?
The one that I received is the J&J, and it's only 1 dose. The one that was supposed to be given in 2 doses was the AstraZeneca that was put on hold, and the period between was 4 to 6 weeks. But however, the good thing about the one that we are using right now is that you get only 1 dose and it's fine.
That's obviously good news. And just a point of awareness around, once you get the vaccine, it's obviously still important for individuals that receive the vaccine to maintain social distancing and continue to protect themselves.
You still have to continue with the non-pharmaceutical protocols, wearing of masks, washing of hands regularly with soap and running water, and the use of the use of the mask and maintaining of the social distancing. That is all important. All the non-pharmaceutical protocols still need to be observed, even if you have the vaccine. Until the time that we have been able to at least vaccinate 67% of the population, we need to continue with the non-pharmaceutical protocols.
MEC, thank you for speaking to us, and congratulations on getting started.
Thank you very much.